Gustavo Garcia.
¿Qué es la problema?
We're gonna go right here to the right.
What brings you in today, Michael?
Oh, I'm sorry. That's not nice, huh?
The hallways are tight, the phones don't stop, the waiting room is crowded, and there is always someone signing in.
If you don't like chaos and confusion and quick action, it can be overwhelming to some people. I had one gal she was new, and I could tell the first day she started, her eyes were like big, like, what am I doing here?
Gail really Tomsky is the director of nursing at the Neighborhood Healthcare Clinic in Escondido, California. While seeing as many as 200 patients a day may sound intimidating, Tomsky says some nurses, like Bernadette Kennedy, thrive in this hectic environment.
¿Por cuántos días?
Ya lo traje, no sé si me entienda, lo traje el viernes, la semana pasada.
The patient population here is roughly 70% Hispanic and 80% pediatric. Kennedy is not fluent in Spanish, but she knows enough to get by.
7 días, aproximo.
This boy has been suffering from a bad cough, especially at night, for the past several days.
Ya le dieron medicina, pero no se le quita la tos, en la noche le provoca mucha tos.
Okay. And tiene fiebre?
After going over the boy's chart, Kennedy is on the move. Again.
Okay, go ahead and take a seat here, and then she'll be with you in just a few minutes, okay? So we bring them back, and then they're seen, and then they go, and they're all done. And if they need labs drawn, then we can send them to our lab. If they need a prescription, we can send them to our pharmacy to have that filled.
So what brings you in today, Michael?
Well, I've been having pain, like both legs actually, from my butt to my calf.
Okay.
But I got a boil right here the other day, and just yesterday, or Saturday, I hit myself with a piece of wood right here, and my ankle just went.
In spite of the huge patient load, Kennedy, who has been with the clinic for almost a year now, still believes it's important to spend time with each patient.
Because we can take care of the issues for today, and then in the future, schedule an appointment to establish care here so that they can start treating you for your blood pressure. Yeah. Well, we have a lot of really good doctors here, and we can see you and get you taken care of. Alrighty, so it'll just be a few more minutes in the waiting room, and then the next available appointment you'll go back, okay? Alrighty. Thank you. You're welcome. Yeah, I mean, we get a lot of people that have been frustrated with, prior situations or a lack of care, so we really try to just, get patients in, get them seen, and take care of them as quickly as possible. And they really appreciate it. We have really great patients here.
There are 2 nurses on staff at the clinic at all times. Tomsky also assists when needed. Kennedy and her fellow nurse, Desiree Turner, both have ER backgrounds. So what's the difference between the emergency department and a community clinic?
The ER is great because, they need care now and they're really sick and they need to be stabilized. But, where do you go after that? And that's where the clinic, I think, is key, because they need to have follow-up treatment or they're going to end up back in the ER time and time and time again. And
are you okay? Yeah. Well, that's a good thing. I like that we're providing care for patients who don't have the money and the, to be able to have health care, so they're able to come here and get the help that they need. Okay, go ahead and have a seat. What brings you here today? Okay, and have you had those in the past?
Oh, yes.
Okay, so tell me what's going on. Are you having frequency, pain with urination? Any blood with the urination? No blood? Okay. We're gonna put this in the doctor's box. And now she'll just wait for the next available time.
For those without insurance, this clinic serves as one-stop shopping for health care. There is a pharmacy and labs. There are 20 patient rooms and 9 doctors on staff at all times. Tomsky says this is the busiest of the 13 neighborhood healthcare clinics in San Diego, and with that comes challenges.
We don't have a lot of support. We don't have, a big central supply and operating rooms and x-ray facilities, so we kind of have to make do with things.
The clinic is budgeted for 180 patients a day, but that number obviously fluctuates. During a flu outbreak 3 years ago, that number swelled to 250. About 1/3 of the patient population is walk-ins, and there are programs that offer free vaccinations for children.
That's one of the things that I really enjoy about working here is that, we just offer a lot to our patients. So they come in and they may not have any health care, and within a matter of days they can see a specialist. We do a lot of referrals out for the specialties and that kind of thing. And
Okay, that's it. Just have a seat out there and we'll get you back in just a few minutes.
From Escondido, California, I'm Mark Prescott for Nurse TV.